Good morning, everyone. We are Group 5, and we'd like to present our topic on pharmacogenomics, tailoring cancer treatment based on genetic variations. Let's dive into pharmacogenomics and what it's all about. Pharmacogenomics, a critical aspect of precision medicine. Pharmacogenomics studies how genetic variations affect individual responses to drugs. In cancer treatment, pharmacogenomics helps us personalize therapies by selecting the best drugs and doses based on the patient's genetic makeup. Instead of using standard treatment protocols, which often results in adverse reactions or ineffectiveness, pharmacogenomics allows for treatments that are tailored to each individual, improving drug efficacy and minimizing toxicity. This is especially important in oncology, where tumors are genetically diverse, and treatments often fail due to genetic differences. Pharmacogenomics is at the intersection of genomics, bioinformatics, and clinical oncology, and is challenging the way we approach cancer therapy.
Why pharmacogenomics matters in cancer treatment. Cancer treatment are not one size fits all. Patients with the same cancer type often have different responses to the same drug due to their genetic variations. Pharmacogenomics help address this issue by improving both efficacy and safety. Let's break it down. Toxicity risks. Variants like UGT1A1 in colorectal cancer patients treated with irinotecan can lead to severe side effects. With PGX testing, these risks can be mitigated by adjusting drug dosages. Secondly, drug resistance. Mutations in KRAS in small cell lung cancer make EGFR inhibitors ineffective. PGX helps identify these mutations, enabling oncologists to avoid ineffective drugs. And finally, improve efficacy. For breast cancer, testing for HER2 positivity can identify patients who will benefit from the trastuzumab drug targeting the specific mutation. By following on genetic differences, pharmacogenomics allows for personalized therapies that are far more effective and safer for each patient.
Pharmacogenomics revolves around two major types of genetic variants that influence drug response. First, germline variants. These are inherited genetic differences present in every cell of the body. They affect how we metabolize drugs. For example, CYP2D6 variants impact how tamoxifen is metabolized in breast cancer. Second is somatic mutations. These mutations are specific to tumor cells. Mutations in genes like EGFR and BRAF are crucial because they affect how the tumor responds to therapies like targeted therapies. Key markers used in pharmacogenomics include SNPs, indels, and copy number variations. These genetic differences affect both pharmacokinetics, how the body absorbs, distributes, and processes drugs, and pharmacodynamics, how the drugs interact with their targets. By identifying these variants, we can make more informed decisions about drug selection and dosage, ultimately leading to better outcomes.
Now let's walk through the pharmacogenomics workflow, which involves several key steps in translating genetic information into actionable treatment decisions. First, we have sample collection, which involves collecting genetic material from blood, buccal swabs, or tumor biopsies. And tumor biopsies specifically provide crucial data about genetic alterations specific to the cancer, which help us to tailor the therapy. Then we have DNA extraction and genotyping, which involves the extracted DNA being tested for specific genetic markers using methods like next-generation sequencing or targeted sequencing to identify relevant genetic variations. Then there's the variant calling, which uses tools like GTK or BCF tools, which are used to identify genetic variants such as SNPs, indels, and copy number variations. And these variants are critical for understanding how the body will respond to certain treatments. Then we have variant annotation, which uses tools like ANNOVAR or VP to determine the functional impact of those variants. And we need to match these variants to clinical databases such as PharmGKB to understand how they affect drug response. Then finally, we have clinical interpretation, which uses tools like GeneSight or CPIC guidelines to help translate the genetic information into real treatment recommendations. And this is all to guide oncologists in choosing the right drug dosage for the patient based on the genetic profile. And all this workflow ensures that the genomic data is processed correctly and translated into personalized, actionable treatment plans for cancer patients.
Several bioinformatic tools and databases help interpret genetic data and link it to actionable drug decisions. Here are the most important ones. PharmGKB. This is a comprehensive database of gene-drug interactions that help clinicians identify which genetic variants affect drug efficacy or toxicity. CPIC stands for Clinical Pharmacogenetics Implementation Consortium, CPIC, provides guidelines for how to adjust drug dosages based on genetic variants. GATK, the Genome Analysis Toolkit, is used for variant calling, helping identify SNPs and indels in sequencing data. ANOVA/VEP, these tools annotate variants by predicting their functional impact on drug metabolism and effectiveness. So these databases and tools help us interpret genomic data and match it to existing clinical guidelines for cancer treatment, making pharmacogenomics a powerful tool for personalized medicine.
Case Study 1, Breast Cancer and Tamoxifen. Let's look at a real-world example. Tamoxifen is a commonly used drug in ER-positive breast cancer. Tamoxifen is activated by the CYP2D6 enzyme, but poor metabolizers with certain CYP2D6 variants have lower active drug levels, leading to reduced effectiveness. For patients with these genetic variants, genetic testing for CYP2D6 can guide treatment decisions. If a patient is a poor metabolizer, the oncologist may switch to an alternative therapy or adjust the dosage to improve the drug's effectiveness.
For colorectal cancer, irinotecan is often used, but UGT1A1 genetic variants affect its metabolism. The UGT1A1*28 variant reduces enzyme activity, causing a toxic accumulation of irinotecan's active form SN38. This results in severe side effects such as neutropenia and diarrhea. PG's testing identifies these mutations, allowing clinicians to adjust the dosage or select a different treatment to avoid these toxicities.
Pharmacogenomics is being integrated into clinical settings at leading hospitals like St. Jude's and Mayo Clinic, which use PGX panels to test multiple genes at once and guide treatment decisions. However, the widespread implementation of PGX faces some challenges. Firstly, there's cost, obviously, because genetic testing can be expensive, especially in low-resource settings. Then there's integration with clinical systems because PGX testing can be incorporated into electronic health records for smooth integration into clinical workflows. Then there's clinical education. More training is needed to help clinicians interpret PGX results and apply them in practice. But despite these challenges, the integration of PGX will continue to grow, allowing for more personalized and targeted treatments in oncology.
There are still several challenges to implementing pharmacogenomics. The first is data bias. Most studies have focused on European populations, so there's a need for more data from diverse population. The second is interpretation of rare variants. The clinical significance of rare variants still remains uncertain. And third is the social and clinical barriers, where clinicians are hesitant due to lack of training, and there's ethical issues where genetic privacy and consent becomes an issue.
The future in prospects in pharmacogenomics. The future of pharmacogenomics in cancer treatments is promising. The key developments include pan-cancer PGX panels to test broad range of genetic markers simultaneously, AI-powered platforms to analyze genomics and clinical data to make real-time treatment decisions, and finally, global collaborations that will provide data for more population-specific guidelines and more equitable access to PGX-based care. PGX will become a routine practice in oncology, allowing for more precise, effective, and personalized cancer treatments.
To conclude, pharmacogenomics is transforming cancer treatment by tailoring therapies based on individual genetic variations. As we have shown with tamoxifen and irinotecan, genetic testing can help identify the best drugs and dosages, improving efficacy and safety. As PGS advances, it will continue to be an essential tool in precision oncology, leading to better patient outcomes. Thank you for your attention.